Okay, so get this. We're diving deep into multi-disease digital health passports in Africa.
Oh, wow.
You know, like those things that could like hold your whole medical history?
Yeah.
Kind of like a super-powered version of those yellow vaccine cards, you
Right.
know? But it's actually way more than just for travel.
Oh, yeah.
This is like tech that's causing a stir because it could like change how healthcare works on a global scale.
For sure, for sure.
So we've got this research paper called Discursive Framework for a Multi-Disease Digital Health Passport in Africa, a Perspective, and it's published in Globalization and Health,
Okay.
and it is packed with insights.
Yeah, and what's really interesting is how, like, Africa's history with these paper health passports
Right.
is informing this, like, digital leap they're taking.
Yeah.
Like, think about it. They've been using paper systems for decades to track things like childhood immunizations. And this paper highlights a case in Zambia
Okay.
where these passports weren't just records,
Right.
but they, like, empowered people to take ownership of their health data.
That's pretty cool.
Yeah.
It's a cool foundation. So like jumping into the digital age.
Yeah.
What kind of information are we talking about storing in these MDDHPs?
So it's pretty comprehensive. We're talking like core demographics, but then you add in your whole medical history, like conditions, surgeries, allergies, medications,
Wow.
even things like medical devices you might have.
Okay, that's a lot to keep track of.
Yeah.
I'm guessing things like lab results and family history are also in the mix?
Absolutely. Diagnostic data like blood work, imaging reports, BMI, and even family history to like assess potential genetic risks.
Right.
Like, imagine the impact this can have in an emergency.
Oh, yeah.
Especially you're like traveling all that crucial info right at your fingertips.
Yeah, I can see how it would be life-saving for individuals, but I'm also thinking about like the implications for public health.
Yeah.
This feels like a goldmine of data, right?
Yeah, you hit the nail on the head.
Yeah.
Think like real-time tracking of disease outbreaks.
Right.
Assessing the effectiveness of vaccination campaigns on a large scale. The paper even talks about using this data to tailor travel advisories based on like individual and regional health risks.
That's some next level stuff, but let's be real. You know,
Yeah.
there's always a flip side. What about the data security risks with all this sensitive information just like floating around digitally?
Yeah, it's a huge concern, and the paper dives right into it.
Okay.
They propose like this multi-layered security approach.
Okay.
Strong access controls for one, so you control who sees what.
Right.
And of course, encryption, like making that data unreadable without the proper key.
Those are the basics, but I'm curious about the tech. I know blockchain gets thrown around a lot these days. Is that part of the solution here?
Absolutely. Blockchain's like decentralized and tamper-proof nature makes it a front runner for securing this kind of sensitive data.
Yeah.
Imagine it like a digital ledger spread across a network of computers.
Right.
Virtually impossible to hack. And what's even more fascinating is that blockchain could give individuals more control over their own data.
Interesting.
It's like revolutionizing how we approach patient consent and data sharing.
Okay, so the tech seems promising.
Yeah.
But even with a super secure system,
Right.
aren't there still legal concerns about how this data could be used? Like,
No.
could someone be discriminated against based on their health information?
Yeah, so this is where the legal framework comes in.
Okay.
The paper specifically discusses like the African Union's Malabo Convention, which is like their version of Europe's GDPR.
Okay.
It sets standards for data protection and aims to prevent things like insurance companies or employers from discriminating based on someone's health data.
That sounds like a step in the right direction, but I'm wondering about enforcement. Are those safeguards really enough to prevent misuse? Yeah, that's a good point. Like, laws are great on paper, but actually making them work in the real world,
Yeah.
that's a whole other challenge. So
Right.
what's the paper's take on that?
Well, it really stresses the need for like a multi-pronged approach.
Okay.
You need those strong laws for sure, but then you also need like clear enforcement mechanisms
Right.
and like a system for accountability if things go wrong. And it can't just be top down, like public awareness campaigns are key.
Right.
People need to understand their rights
Right.
and like how their data is being used.
I get that knowledge is power.
Yeah.
But even if we get all the legal stuff ironed out and thinking about the practical side of things,
Yep.
Africa is a massive continent with like varying levels of tech development.
Right.
How do we make sure this isn't just a solution for like the privileged few?
So you're touching on a core issue, like the digital divide.
Okay.
And the paper actually argues that simply like expanding internet access isn't enough. It's about digital literacy too.
Okay.
Making sure people have the skills to use these passports effectively.
Yeah.
Think about it. Like, what good is a fancy new phone if you don't know how to use its features?
Totally. So we're talking about a major investment in infrastructure,
Hmm.
and not just the tech itself, but like education and support systems.
Right.
Which brings up a question for me.
Yeah.
The paper talks about encouraging innovation and research,
Hmm.
but like, doesn't that often come with a hefty price tag?
Yeah.
Can countries with limited resources really afford to be on the cutting edge of digital health?
It's a valid concern, and the paper acknowledges it head on.
Okay.
It's about finding that sweet spot between using existing infrastructure
Mm-hmm.
and smartly investing in new technologies where they'll have the most impact.
Mm-hmm.
Think of it as like building a house.
Right.
You need a solid foundation. First, that's your basic infrastructure.
Okay.
Then you can add the cool features, the solar panels and smart gadgets as resources allow.
So not trying to build a tech utopia overnight,
Right.
but rather like a phased approach.
Exactly. And that's where collaboration becomes crucial.
Okay.
The paper talks about partnerships between governments, tech companies, healthcare providers, and researchers.
Yeah.
By sharing knowledge and resources, they can fast-track development and find solutions that are both effective and affordable.
Okay, I'm starting to see the pieces fall into place.
Yeah.
We've talked a lot about the why and the how of MDDHPs, but let's circle back to the potential impact on public health.
Okay.
Earlier you mentioned things like real-time outbreak tracking and improved vaccination programs.
Right.
Can you break that down a bit more?
Imagine having a dashboard that shows you disease trends across an entire region or even the continent.
Wow.
With that kind of insight, you could identify outbreaks much faster, target interventions more effectively, and even allocate resources based on real-time data.
Right.
It's like having a finger on the pulse of public health,
Yeah.
allowing for a more proactive and strategic response.
So instead of playing catch-up, you're ahead of the curve.
Exactly.
That sounds incredibly powerful, but what about the impact on individual patients?
Right.
How could this change the way we manage chronic conditions, for example?
Think of a diabetic patient who can easily share their blood sugar readings and medication history with their doctor,
Okay.
no matter where they are in the world.
Right.
That kind of seamless data flow could personalize healthcare like never before, leading to better management of chronic conditions,
Right.
and potentially even preventing complications down the line.
That's a game changer, especially in areas where access to specialized care is limited.
Yeah.
But I have to ask, even with all the security measures and legal frameworks in place, doesn't this raise concerns about data privacy?
Right.
I mean, it's one thing to share your information with your own doctor, but what about other healthcare providers or researchers or even insurance companies?
So you're right, those are legitimate concerns, and the paper emphasizes the importance of patient control over their data.
Okay.
Imagine it like this. You have a digital lockbox for your health information.
Uh-huh.
And you get to decide who has the key and what information they can access.
Interesting.
It's about empowering individuals to make informed choices about their data,
Right.
while still allowing for the safe and responsible sharing of information that can benefit both individual and public health.
That makes sense. So it's about striking that balance between privacy and progress.
Right.
But I'm curious, even if we manage to address all the technical and ethical challenges,
Yeah.
is there a risk that this could create a two-tiered healthcare system
Right.
where those with access to the technology benefit while those without get left behind? That's a really important question. We can't just assume everyone will automatically benefit from this tech.
Right.
So what does the research suggest about ensuring equitable access?
Well, it highlights that equity needs to be baked into the system, from the ground up.
Right.
It's not just about the tech itself.
Right.
It's about addressing those underlying social and economic factors that contribute to the digital divide.
I see.
Things like affordability, accessibility in remote areas, even language barriers.
Yeah.
All of these need to be considered.
So it's about creating a system that's inclusive by design, not as an afterthought.
Exactly.
That makes sense. But even with the best intentions, there are always going to be unforeseen challenges and potential downsides to any new technology.
Right.
So what are some of the things we should be watching out for with NDDHPs?
Well, one thing that immediately comes to mind is the potential for misuse.
Okay.
Could this data be used for surveillance or to discriminate against certain groups?
That's a worry.
It's a valid concern, and the paper emphasizes the need for strong safeguards and oversight mechanisms to prevent that from happening.
So it's not just about building the tech, but also about building in those checks and balances to make sure it's used responsibly.
Exactly.
What else should we be thinking about?
Well, there's the whole issue of algorithms and bias.
Uh-huh.
These systems will likely rely heavily on algorithms to analyze data and make decisions.
Okay.
We need to be very careful about how those algorithms are designed and trained
Right.
to ensure they're not perpetuating existing biases or creating new ones.
Yeah, that's a great point. We've seen how algorithmic bias can creep into all sorts of technologies.
Oh, for sure.
From facial recognition software to loan applications. It's crucial to address that from the get-go.
Yeah.
But let's shift gears a bit and imagine for a moment that we've managed to overcome all these challenges.
Okay.
What would a future with MDDHPs actually look like for, the average person?
So imagine traveling to a new country.
Okay.
Instead of rummaging through your bag for that crumpled yellow card,
Right.
you simply present your digital health passport at the border.
Yeah.
All your necessary information is right there,
Uh-huh.
secure, verifiable, and instantly accessible.
Wow.
No more lost records or language barriers.
Right.
Just a smooth and efficient process.
Okay, that sounds pretty convenient.
Yeah.
But what about people who don't have smartphones or reliable internet access? Would they be excluded from this, digital health utopia?
So that's where those alternative formats come in.
Okay.
We're talking about things like physical cards with QR codes that could be scanned.
Right.
Or even systems that allow for offline access to your data.
Interesting.
The key is to design a system that's flexible and adaptable to different needs and contexts.
So it's about making sure everyone has a seat at the table, so to speak.
Yeah,
Regardless of their, tech savviness or socioeconomic status.
exactly.
That brings up another question.
Mm-hmm.
Beyond the travel and public health applications,
Yeah.
what are some of the other ways MDDHPs could empower individuals?
Imagine having your entire medical history at your fingertips.
Okay.
You could easily track your progress towards health goals, monitor any chronic conditions,
Right.
and even share your data with researchers to contribute to medical advancements. Wow. It's about putting individuals in the driver's seat when it comes to their own health.
I'm starting to see the bigger picture here.
Yeah.
It's not just about making healthcare more efficient,
Right.
but also about making it more patient-centered and empowering.
Exactly. It's about shifting the paradigm from reactive to proactive healthcare.
Well, I think we've covered a lot of ground in this deep dive.
We have.
We've explored the potential benefits and challenges of MDDHPs, from
Yeah.
the technical nitty-gritty to the broader societal implications.
And what's so exciting about this field is that it's constantly evolving.
Yeah.
There's so much more to learn and explore as this technology develops.
Absolutely. So for our listeners who are now buzzing with questions and eager to delve deeper,
Yeah.
what's the next step? Where should they go from here?
I highly recommend checking out the full research paper we've been discussing.
Okay.
It's packed with insights and really dives deep into the nuances of this topic. And remember, this is a conversation that's just beginning.
Couldn't have said it better myself. Thanks for joining us on this fascinating journey. Until next time, stay curious.